Hello everyone and welcome to Laboratory M5, where we'll cover the gluteal region including lateral rotators and the anterior, medial, and posterior thigh muscles.
So first we'll start off with the gluteal region, and we have four major muscles here: our gluteus maximus, gluteus medius, and minimus. And then we have our tensor fasciae latae, and we'll be talking about something called the IT band. So what you want to keep in mind first is that all of these muscles originate from the ilium. Now, I've been saying it over and over again just so I make sure that you guys don't study extra material, but you do not have to know the origins or insertions for any of these muscles. I just want to describe them to you so you understand the placement, the attachment of this muscle, of these muscles, I should say. So all of these, except for the gluteus maximus, are going to be innervated by the superior gluteal nerve, and I'll show you why in the coming slides. So here's our gluteus maximus. It is the most superficial. It's going to originate from the ilium. So we see that right here, that part of the iliac crest and that posterior superior iliac spine. And then we have the sacrum, which would be right in here, and then the coccyx. Then these fibers reach on over and insert into the gluteal tuberosity onto the femur. Its action, so remember we're bringing this insertion closer to the origin, will assist us in extending and laterally rotating the thigh at the hip. And its innervation is inferior gluteal nerve. Now soon we're going to learn about our gluteus medius and minimus, which sit right underneath this fascia here, and our tensor fasciae latae, which is over here. So you could see that this gluteus maximus is sitting more inferior compared to these other ones that are innervated by the superior gluteal nerves. Next we have gluteus medius and gluteus minimus. So all of these gluteal muscles are kind of stacked on top of one another. Yes, that gluteal maximus that we see reflected over here sits a little bit lower, but here it's overlapping here with the gluteus medius, and underneath that would be the gluteus minimus, which is the deepest gluteal muscle here. Now I do these muscles together because they share everything in common. So both muscles are going to originate from the ilium, insert into the greater trochanter, which this is a really great view of that, and they're going to abduct and medially rotate the thigh. It makes sense that it abducts because it's coming from this superior section here, and some of the fibers are reaching over at an angle, so that is going to cause medial rotation. Next we have the innervation, which is superior gluteal nerve. So that's gluteus maximus, gluteus medius, and gluteus minimus, from superficial to deep. Now we have our tensor fasciae latae, and so this is one of my favorite muscles because I love coffee, and it's kind of spelled like latte, right? So of course, when I was in college, I thought it'd be so funny if I go to Starbucks, and of course it was one that I studied at all the time, so they kind of knew me there, and I asked for a tensor fasciae latte. And they were like, "Oh, is that a seasonal one?" And the girl must have been new. She was kind of looking for it on the screen. And I was like, "Oh, no, you have it." And she's looking, and then she calls over another employee, and they're like, "Oh, I'm sorry, miss, we don't know what you're talking about. I don't think we have that one." And I was like, "Not only do you have one, you have two." And then I pulled out my Netter Anatomy Atlas, and I'm showing them pictures and describing the origin, insertion, and action and innervation. Meanwhile, all these people standing behind me are a little bit frustrated with me. But then, of course, I was like, okay, just thought I'd share that knowledge with you, and proceeded to order an actual coffee. But I thought it was really fun. I don't care if anybody didn't find it amusing. So here we have the tensor fasciae latae. It's actually a very small muscle belly here, and it originates from the iliac crest and the anterior superior iliac spine. And then it goes down and inserts into what's known as the IT band. And all of this in here is the IT band. And it's really just a thickening of fascia on the lateral aspect of the thigh. And what IT stands for is the iliotibial band or tract. So it describes the attachments. So you might also see that when you contract this muscle, and do the actions of flexion and medial rotation of the thigh, it's that movement of crossing your legs. So when women are, or men are wearing shorter shorts or a skirt, you will sometimes see an indentation on this lateral aspect of their thigh, and that's because we have pulling of this IT band on the skin, causing that indentation. And this, once again, is innervated by the superior gluteal nerve. And here's just another look at this IT band here. Next, we have our lateral rotator muscles, and this is great because they all have the same action, and almost all of them have the same innervation, except for a special one, piriformis, which is just nerve to piriformis. So let's start off with that piriformis. If you find your gluteus minimus, so I want you to find that on your screen, right underneath that you're going to have a pear-shaped muscle. And that's this one right here. And it's located above the sciatic nerve. Now, in very rare instances, I think it's something like 12% of the time, this sciatic nerve can pierce the piriformis. And so you can imagine if you have any type of tightness or inflammation in this muscle, you are going to have some issues with your sciatic nerve, mostly sciatica. So this piriformis muscle actually goes underneath our sacrum, which would be right in this region here, and it originates from the anterior portion of it. Then it reaches on over and inserts into the greater trochanter along with the minimus and, minimus and the medius. So it's going to have lateral rotation of the thigh. Now that this piriformis muscle is a little bit lower on the angle of pull here, that's how we have lateral rotation of the thigh. Innervation here is going to be nerve to piriformis. Next we have superior gemellus, and gemellus means twin. And the reason for this is we are going to talk about another muscle in a moment called inferior gemellus, so that's its other twin there. And this muscle is found below the sciatic nerve. The origin is going to be the spine of the ischium, and its insertion is the OI tendon. What OI stands for is this muscle that lies below it, and that is the obturator internus muscle. So this muscle, I know it looks like it's going over to the greater trochanter, but it actually inserts itself onto the tendon of this obturator internus muscle. Its action is lateral rotation, and innervation is now going to be sacral plexus for the rest of these muscles. So here's our obturator internus, and like I said, I know it looks like that these are pretty muscular in here. When you look at this on the cadaver, this is actually more of a white tendon in this region, and the real muscle belly is down over here. So the origin of obturator internus is the internal surface of the obturator membrane. Remember, we have that obturator foramen in the os coxa, and that foramen is covered with an obturator membrane. So this muscle is just on that inside surface of that. The insertion is going to be greater trochanter. Innervation, skipped action here. Can't do that. It's going to be lateral rotation of the thigh, and innervation is sacral plexus. Now we get to the other twin here, and that's going to be our inferior gemellus. So this originates from the ischial tuberosity, and it too is going to insert into the OI tendon. Its action is lateral rotation of the thigh, and innervation is sacral plexus. Now I like to call this the Oreo cookie of the butt because that's what it looks like. If you look at this in the cadaver, you will see that there is the two gemelli, superior and inferior gemelli, that are darker because they're more made of a muscle bulk, whereas this obturator internus, all of it in here is mostly tendon, so you'll see that it's more white. So hopefully I didn't ruin Oreos for you because they're delicious, right? But it's a good way to memorize the order of these muscles. And then lastly, we have our quadratus femoris here, And this is quadratus because it's four-sided. It's a square-shaped muscle of our thigh. And it's going to originate from the ischial tuberosity, which you see right in here. This is our ischial tuberosity. And then it goes over, and there isn't quite enough room for on that greater trochanter for it anymore. So it inserts onto the intertrochanteric crest. Remember that the crest is always posterior. Think PC. And the action of this is lateral rotation of the thigh. And innervation will be the sacral plexus. So let's identify these real quick. What is this muscle at the very top in red? If you said piriformis, you are correct. Next in line we have in blue, superior gemellus. And then next in that grayish color, obturator internus. Below that, inferior gemellus. And lastly, we have the quadratus femoris. So next we're going to move into our anterior thigh muscles. And we have quite a few here, but a big chunk of it is the quadratus femoris. So we'll get into these four separate muscles, but I want you to notice that all of them are innervated by the femoral nerve. So the femoral nerve really innervates all anterior thigh muscles. So starting off with our iliopsoas, the P is silent here. And it's made up of two separate muscles. We have iliacus, which really sits in that iliac fossa, and psoas major, and sometimes we have a psoas minor that travels along with this, but in certain populations it is missing as well. So we'll see what we see on our cadavers. And these two muscles kind of come together, their fibers come together to insert at the lesser trochanter. So when I put in the origin here, lumbar vertebrae, that's really the psoas major muscle that's originating from there. So what this muscle does, I call it the filet mignon muscle because it's the same muscle that they take out in cows. And the action of this in us is to flex the trunk. And do cows ever really flex their trunk? Not any that I've seen. So this is why it is so tender and we are able to enjoy it when we go to a nice steakhouse. If you're not a vegetarian, that is. And this will be innervated by the femoral nerve. So like I said, it's made up of two muscles. So I just wanted to show you what this looks like in the abdomen. So here's our iliacus. Like we said, it's from that iliac fossa. And psoas major, it's a little bit cut on this side, so you don't really see the full scheme of it. But you could see it a little bit better here if you kind of cut out this ureter and artery out of the way. So you could see it's reaching on up and originating from the lumbar vertebrae that sit back in here. And then these fibers blend together and they're going to go down and insert into the lesser trochanter. So next we'll go to another favorite muscle of mine. I'm starting to see that I have way too many favorite muscles. I got to narrow this down. But sartorius is another one of them, and I just love shouting its name. Sartorius, right? It'll stick in your head. And this muscle was named because to be very sartorial was to be very well dressed. And so this is the muscle that a lot of tailors would use when they sat down on the floor cross-legged to do their sewing. So let's talk about it in detail. Its origin is going to be from as is here, and then it reaches on over and inserts into the upper medial tibia. Now don't worry about what pes anserinus is. If you're interested in what it is, I can definitely talk about it in our cadaver lab. So inserts there, and then like I said, this is the movement, the action that tailors would do to do their sewing. So they would, and you could do this along with me in the video, so you're going to flex at your thigh. You're going to abduct and laterally rotate your thigh. So now at this point, you should, well, let's complete it and flex the leg. So you're kind of sitting cross-legged, or I know in kindergarten class they would call this like Indian style. So you're sitting with your legs crossed. And so to memorize the action, I always think this muscle falls across the thigh. And so that would stand for flex, abduct, and laterally rotate the thigh. And I would just have to remember flex leg at that point. and the innervation is femoral nerve. And then this is your pes anserinus. We're going to have three muscles that insert into this location. And what pes anserinus means is goose's foot. So this kind of, with these three tendons here, looked like a goose's foot. So this is going to be sartorius. We have gracilis and semitendinosus. Okay, so now we get into our quadriceps femoris. So remember, breaking this word down, we know it's the four-headed muscle of the thigh, and they're all going to share a common insertion, common action, and innervation. And we break this up into our four muscles: rectus femoris, vastus lateralis, vastus medialis, and if we cut away that rectus femoris, you can see your vastus intermedius. Okay, so let's go through each of these individually. So here's your rectus femoris. It is originating from your acetabulum and your AIIS. It then is going to reach down into your to attach to your tibial tuberosity. And you guys can palpate your tibial tuberosity, right? So you'll see exactly where all of these muscles are inserting. And by doing that, all of these muscles are also creating that patellar tendon and encasing this patella, making it a sesamoid bone. Now the action of this, because it's crossing two joints, your hip joint and your knee joint, it is going to flex the thigh as well as extend your knee or extend your leg. And the innervation is femoral nerve. And I mentioned this in class, but rectus means straight and femoris would mean thigh. Next we have your vastus lateralis, and this is wrapping from posterior to anterior, so it's originating from the linea aspera on your femur as well as the greater trochanter, and then inserting into the tibial tuberosity. And now you're going to see that the rest of these vastus muscles will only extend the leg at the knee. For your exam, I really don't care if you say extend leg or extend knee, as long as you're getting the correct action. And the innervation is femoral nerve. And vastus means large, so all of these muscles are very large. This one happens to be on the lateral side. Next we have vastus medialis. It's originating from the linea aspera only because we don't really have any trochanters on this medial surface. And then it'll go and insert into the tibial tuberosity. It's going to extend the knee as well and be innervated by the femoral nerve. Now we cut that rectus femoris out of the way so we could see our vastus intermedius. This is just originating from a general region of the upper femur. It's reaching down to insert into the tibial tuberosity. It'll extend the knee and be innervated by the femoral nerve. So now we're going to jump into our medial thigh muscles. And you're going to see that almost all of these are going to abduct and flex the thigh, and almost all of them are innervated by the obturator nerve. So you're sitting in class and listening to lecture, and of course you're taking your notes, being really studious until ring, ring, ring. Hello, obturator. So I know nobody has a phone like this anymore, but I just kept it in my lecture. But most people keep their cell phones in their lap near their medial thigh muscles. So now it's going to be easier for you to remember that our medial thigh muscles are innervated by the obturator nerve. So our first muscle is gracilis, and this is such a cool muscle. It's very lengthy and slender. One of my old anatomy instructors, he used to teach at U of D Mercy, University of Detroit Mercy. He was an anatomist within their dental program, and he loved this muscle so much that he named his daughter Gracie. So I don't know, I'll always think of that when I talk about gracilis now, but it originates from the pubis and will go down and insert into that special place I was mentioning with sartorius, the upper medial tibia. So it helps create that pes anserinus. The action of this muscle will be to adduct and flex the thigh, and innervation is obturator nerve. Next we have pectineus, and this too is going to originate from the pubis and insert into a general area, once again, the upper femur, although this area is much smaller than the region that the vastus intermedius originates from. The action of pectineus is to adduct and flex the thigh, which is why we place it as a medial thigh muscle, but its innervation is from the femoral nerve. So this is our one exception. Well, I shouldn't say one exception. There's another half muscle that has an exception as to being a medial thigh muscle that's innervated by a nerve other than obturator nerve. And now we have adductor longus and brevis, and it's kind of nice because both of these muscles share everything in common. So they are going to be layered on top of one another, so I don't have a great picture of brevis, but your longus is on top and brevis would be lying underneath. They're going to originate from the pubis as well, and its insertion is linea aspera. And I want you to remember that any muscle that has the name adductor in it is going to insert into the linea aspera, at least in the thigh region. And its action is to adduct and flex the thigh, and innervation is obturator nerve. Now, we had to peel a lot of these medial thigh muscles away so you can see the adductor magnus in its entirety. We have an adductor part and an extensor part. So I'll show you the difference between these two in the cadaver lab because it can be a little confusing with all of the muscles still intact. So first we'll start with the adductor part. It originates from a region on the pubis, that ischiopubic ramus. So I always like to remember this as you're adding the two bones together, hence the origin of adductor part is the ischiopubic ramus. The insertion, because it's an adductor muscle, is going to be linea aspera, and its action is to adduct and flex the thigh, like the rest of our medial thigh muscles. And innervation is the obturator nerve. Now, the other part, the extensor part, I always say they have some sort of multiple personality disorder because one minute it wants to act like an adductor muscle and the other minute it wants to be more like a hamstring. So you can think of, this is an old movie, but Jim Carrey's character in Me, Myself, and Irene. So let's look at why this is. It originates from the ischial tuberosity, which you can't see too well in this image because it's located posteriorly, but the other hamstrings all originate from the ischial tuberosity. But then it goes and inserts onto an adductor tubercle on the femur. So that's more of like a medial thigh muscle characteristic. Its action is to extend the thigh, which is consistent with the hamstring type of action. And innervation is sciatic nerve, which is something all the hamstrings are innervated by. So it's leaning more toward the hamstring side than it is the adductor side, but it is a part of the adductor magnus, and that's why we compartmentalize it as a medial thigh muscle. Now let's move into those hamstrings, our posterior thigh muscles. We have semitendinosus, semimembranosus, and our biceps femoris. And all of these, or almost all of these, are going to extend the thigh and flex the leg, but they are all innervated by the sciatic nerve. So anytime you have a muscle in the posterior thigh, go with sciatic nerve for innervation. So here's our hamstrings, all in this region here. And we say that semitendinosus, semimembranosus, and the long head of the biceps femoris are all true hamstrings. We say that the short head is a false hamstring because it does not fit all of the criteria of being a true hamstring muscle. So what are those criteria? Well, it is going to be that it originates from the ischial tuberosity, it has to extend the thigh and flex the leg, and it has to be innervated by the sciatic nerve. So it does not fit two of the three criteria. And we're going to talk about it toward the end of this section. So first, let's discuss semitendinosus. And we call this semitendinosus because it has a very prominent tendon. I want you to flex your knee right now and feel the medial posterior side, and you're going to be able to feel two tendons there. The more prominent one of those tendons is going to be semitendinosus. It's going to originate from the ischial tuberosity, insert into the upper medial tibia, that special place that creates pes anserinus, and its action is to extend the thigh and flex the leg, and innervation is sciatic nerve. Next we have semimembranosus, and this is another beautiful muscle because it has a great shiny membranous sheen to it, at least when you first dissect it. And it kind of lies deep to semitendinosus. And its origin is ischial tuberosity, but its insertion is medial condyle of the tibia. Its action will be to extend the thigh and flex the leg, and innervation is the sciatic nerve. Now next we have and I wanted to show you this image of semimembranosus so you can kind of see how much membrane it has upon it. And here's your biceps femoris. So this is now on the lateral side of the thigh. And if you go back to flexing your knee and feeling those tendons, I had you feel the medial side with your semitendinosus and semimembranosus, but now I want you to feel the lateral side. Do you feel 2 tendons or just 1? You should just feel 1 because the tendons of your long head and short head that belong to your biceps femoris converge together and will insert into the same place, which is the head of your fibula. So let's take a look at your long head. It's going to originate from your ischial tuberosity, insert into the head of the fibula, and have the same actions: extension of the thigh, flexion of the leg, and innervation of sciatic nerve. Now, if you peel that long head out of the way, you're going to see your short head. And this originates from not the ischial tuberosity, but the linea aspera. It inserts into your head of your fibula. And then the action of this muscle is really interesting because it's lateral rotation of the leg. And you can't really achieve this action unless your knee is in flexion. So remind me to show you this action in our cadaver lab. Basically what you do is you flex your leg and then you're going to laterally rotate your leg. So you're kind of turning your foot out, and that's how you get lateral rotation of the leg. And its innervation is sciatic nerve. So they share the head of the fibula in common and also the sciatic nerve as the innervation.